Hi everybody, this is Dr. Reyes-Fournier and this is Unit 6 where we're talking about treatment of minors and elders with addictions and dangerous clients with addictions. Um, as we've talked about before, each population really has its own set of ethics and issues that we have to deal with. For example, when dealing with people underage, we have the ethical conundrum of having to not only have their consent to treat them, but also we need their parents' consent. In the United States of America, a person who is underage is not allowed to give consent, and they have no authority to consent without first the consent of the parent or legal guardian. In many cases, when you have issues of addiction or substance abuse issues with adolescents, you're also going to have legal entanglements. So who's the guardian of that person at that time? It is sometimes impossible to get parental consent, and you would actually have to involve the courts to issue some sort of writ or something like that, giving guardianship to like a probation officer or somebody in juvenile justice, and it is extremely complicated. Another issue that comes up a lot with adolescents in treatment is that there is no parental involvement. Despite the fact that there is still parents in the picture, they don't necessarily participate in treatment. I will be, obviously passing this along to you, but I'm pretty sure that everybody here owns or has this tip at the ready at all times. For the elderly, we're talking about other issues, specifically because here in the United States, we are want of privacy all the time, and autonomy, as you've read in NADAC and SAMHSA and even the APA, is first and foremost the most important thing that we think about when we look at our clients. How do you intervene when the individual who needs help is unwilling to do so or unwilling to help themselves? And in many cases, you end up finding that not intervening allows the individual to stay in a situation that we would consider to be a danger to themselves. So we need to weigh this idea of confidentiality, privacy, and autonomy with duty to warn and intervening when there's danger to self. So we'll talk about that tomorrow in seminar as well. And the last but not least, working with dangerous clients. If you go to your TAP 21, which has all the knowledge and skills and attitudes of professional practice, and if you ever take your licensing exams in substance abuse treatment and the ICRC exam, it's taken all from Series 21, the TAP 21 from SAMHSA, so you can get all the information there. In this TAP 21, they make a specific say that we need to be ready to work with people who are in crisis or present a dangerous situation. This is something that you will learn, it's one of those on-the-job training things. You will learn from the actual agency that you work with, and you will follow their standard or operating procedures. And also a lot of this takes place while doing screenings. When we're screening, we are looking at, once again, is the person a danger? In cases where anger is one of the first things that is seen from a client, we need to weigh, once again, how is this client going to behave in treatment? Is it safe for the therapist? Is it safe for the other clients to have them there? So all of this stuff will be discussed on Thursday at seminar. It seems like a lot, and it is a lot because they come, each of these categories has their own set of fun things. Okay, so we'll see you tomorrow night, 9 p.m. Thursday. Have a pleasant Wednesday, and we'll talk tomorrow. Bye.